Hello and welcome to another presentation in the Core Web Training series providing instructions in the manual application of the ICD-10 International Rules and Guidelines for Mortality Classification. This presentation examines the instructions on maternal mortality applying step M4. My name is Saman Gamage. I work as a Senior Technical Advisor on Medical Certification and ICD under the Data for Health initiative of the CDC Foundation. And I will be your guide through this presentation along with Patricia Wood and Yusuf Hammond. This presentation and others in the series are based on the WHO Mortality Classification Rules and Guidelines found in ICD-10 Volume 2. These rules and guidelines have been the subject of numerous updates over the years, and we use the 2016 version, which is the most recent readily available one. If you don't already have a copy of the 2016 version of Volume 2, you can find it at the link on this slide. This slide is a reminder of the ICD-10 mortality coding process. First, the mortality classification rules and guidelines in ICD-10 Volume 2 are applied to cause of death information reported on the standard International Medical Certificate of Cause of Death. Next, an ICD-10 code should be assigned to each cause of death reported. Basic coding guidelines can be found in Volume 2 of ICD-10. And finally, the mortality classification rules and guidelines found in Chapter 4 of ICD-10 Volume 2 are applied to the coded information on the death certificate. After coding all causes of death reported, the first step in choosing an underlying cause of death is to select tentative starting point. This is done by applying selection steps SP1 to SP8 as per the rules and guidelines found in ICD-10 Volume 2, Section 4.1 to 4.2.1. These topics are covered in other presentations in this series, so if you need a refresher on it, please look at other videos on this channel. Once a tentative starting point has been selected, the next step is to check whether it is subject to modification by any other information on the certificate. The special instructions for applying modification steps M1 to M4, are found in Volume 2 in Sections 4.2.2 and 4.2.5 through 4.2.9. Step M4. Step M4 is applicable for 4.2.6 special instructions on main injury in deaths from external causes, 4.2.7 special instructions on poisoning by drugs, medicaments, and biological substances, 4.2.8 special instructions on maternal mortality, 4.2.9 special instructions on surgery and other medical procedures. And these 4 topics will be discussed in 4 separate videos. Our previous videos discussed the special instructions on surgery and other medical procedures, and instructions on main injury in death from external causes. And today we will discuss special instructions on maternal mortality. Step M4, special instructions on maternal mortality. This is today's lesson plan. We will first go through the definitions. I will go through the definition of maternal death, late maternal death, pregnancy-related death, direct obstetric death, and indirect obstetric death. And then we will discuss step and 4 rules, and I will also go through some examples. What do you mean by a maternal death? A maternal death is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of the pregnancy, from any cause related to or aggravated by the pregnancy or its management, but not from accidental or incidental causes. This definition of maternal death is an international definition used by the WHO for statistical tabulation, and there are no national variations to this definition. The ICD codes in the chapter 15 of ICD 10 are the ones used to code maternal deaths. The chapter 15 codes range from 0000 to 099. As you know, this definition does not cover accidental causes and incidental causes. What are the accidental causes? For example, pregnant lady hit by a bus, death of a pregnant woman due to an assault. These causes are not considered as maternal deaths. Similarly, examples of incidental causes are drug overdose or substance abuse related conditions, alcohol intoxication. As described in the definition, accidental causes and incidental causes are not counted as maternal deaths. Late maternal death. A late maternal death is the death of a woman from indirect or direct obstetric causes more than 42 days, but less than 1 year after termination of pregnancy. The applicable ICD codes for late maternal deaths are 096.0 to 096.9. Pregnancy-related death. A pregnancy-related death is the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the cause of death. Therefore, deaths of pregnant women due to accidental and incidental causes are also pregnancy-related deaths. Maternal deaths are divided into two groups: direct obstetric deaths and indirect obstetric deaths. As shown in this graph, there are about 20% indirect causes in average globally and 80% are direct obstetric causes. What do you mean by direct obstetric deaths? Direct obstetric deaths are those resulting from obstetric complications of the pregnant status, pregnancy, labor, and puerperium from interventions, omissions, incorrect treatment, or from a chain of events resulting from any of the above. Example, eclampsia, amniotic fluid embolism, obstructed labor, and puerperal sepsis. Direct obstetric deaths are coded to 000 to 092, 096.0, and 097.0. Indirect obstetric deaths are those resulting from previous existing disease or diseases that developed during pregnancy and which was not due to direct obstetric causes, but which was aggravated by the physiologic effects of pregnancy. Examples are congenital heart disease, malaria. Indirect obstetric deaths are coded to the ICD codes 096.1, 097.1, and 098 to 099. A woman dies of pregnancy-related causes every 2 minutes. Therefore, preventing maternal death is extremely important. Preventing maternal death is important for several reasons. Firstly, every woman has the right to survive pregnancy and childbirth, and preventing maternal death is essential for upholding this fundamental human right. Maternal mortality also has a profound impact on families and communities. When a mother dies, her children are more likely to suffer from poor health outcomes and are at higher risk of mortality themselves. Additionally, maternal deaths can have economic implications as they can lead to a decrease in household income and productivity. Let's discuss step 4. If the decedent is a woman and pregnancy, childbirth, or puerperium is reported on the death certificate, determine whether to code the underlying cause to Chapter 15, pregnancy, childbirth, and the puerperium, according to the instructions in Section 4.2.8 of Volume 2, Special Instructions on Maternal Mortality, under Rule Step M4. If pregnancy, childbirth, or puerperium is mentioned anywhere on the certificate, in most cases, the underlying cause is coded to Chapter 15, pregnancy, childbirth, and the puerperium. If pregnancy, childbirth, or puerperium is reported anywhere on the certificate, but it is not clearly stated that pregnancy, childbirth, or puerperium contributed to the death, first contact the certifier and ask for additional information. If the certifier states that the death was a complication of pregnancy, childbirth, or puerperium, code the underlying cause to Chapter 15, pregnancy, childbirth, and the puerperium. If the certifier states that the death was not a complication of pregnancy, childbirth, or puerperium, do not code the underlying cause to Chapter 15. If you cannot obtain any additional information, but pregnancy, childbirth, or puerperium is mentioned in Part 1 or Part 2 of the certificate, code the underlying cause to Chapter 15. If the underlying cause you selected is classifiable to O98 to O99, maternal infectious and parasitic diseases classifiable elsewhere, but complicate in pregnancy, childbirth, and the puerperium, and other maternal diseases classifiable elsewhere, but complicate in pregnancy, childbirth, and puerperium, then add the corresponding code from Chapter 1 to Chapter 16 as a multiple cause of death. This is important because otherwise crucial information on the death will not be retrievable. However, this guidelines is useful for countries producing multiple cause data. In a country coding single cause or just underlying cause coding, this instruction has no value. Note that some conditions are not coded to Chapter 15 even if they occurred during pregnancy, childbirth, or puerperium. See the excludes note at the beginning of Chapter 15. Some examples are human immunodeficiency virus disease, which is coded to B20 to B24, injuries and poisoning coded to S00 to D98, maternal and behavioral disorders associated with the puerperium coded to F53, and another example is obstetrical tetanus, which is coded to A34. And these conditions are not coded to Chapter 15. Having discussed the rules, let's go through some examples. In this death certificate, in Part 1A, amniotic fluid embolism is reported on line 1A, which is coded to 088.1. The underlying cause is amniotic fluid embolism, index to chapter 15, 088.1, and this is a direct maternal death or direct obstetric death. Let's go through another example. Line 1A, pulmonary edema, J81. Line 1B, mitral regurgitation in pregnancy, I34.0 and O99.4. You can apply SP3 and select I34.0 as the tentative starting point. And now you can move on to step M4 and follow the special instruction 4.2.8 in volume 2 on maternal mortality. The underlying cause mitral regurgitation is coded to chapter 15 because pregnancy is mentioned in part 1. Code the underlying cause to diseases of the circulatory system complicating pregnancy, childbirth, and the puerperium, O99.4. And if you are coding multiple cause coding, also add the code for mitral regurgitation, I34.0. As you can see, this is an indirect obstetric death because a pre-existing cardiovascular condition causes the death. Example 3, 1A, hemorrhage, R58, 1B, cervical cancer, C53.9 and O99.8, coded to chapter 15. Part 2, treatment delayed because of pregnancy. We can apply SP3 and select C53.9 as the tentative starting point. And now we move on to step M4. Follow the special instruction 4.2.8 in volume 2 on maternal mortality. The underlying cause, cervical cancer, is coded to chapter 15 because pregnancy is mentioned in part 2. Code the underlying cause to other specified diseases and conditions complicating pregnancy, childbirth, and the puerperium, O99.8. For multiple cause coding, also add the code for cervical cancer, C53.9, as a contributing cause of death. This death is also due to an indirect maternal cause. Let's go through another example. 1A, hepatic failure, K72.9. 1B, dengue hemorrhagic fever, A97.9, O98.5. Part 2, 40 days postpartum is reported. We apply SP5 and select K72.9. Now we move on to step M4. Follow the special instruction 4.2.8 in volume 2 on maternal mortality. In part 2, pregnancy is reported. It says 40 days postpartum. Code the underlying cause to other viral diseases complicating pregnancy, childbirth, and the puerperium, O98.5. Also add the code for dengue A97.9 as a contributing cause of death, and this is important in multiple cause coding. As you can see, this is an indirect obstetric death. Talking about step M4 again, step M4 special instructions are available in section 4.2 of volume 2 under 4 main areas. By now, we have discussed 4.2.6, 4.2.7, 4.2.8, and 4.2.9. All four instructions of all four areas of instructions have been discussed. I hope this presentation was helpful, and see you next time. Thank you.